Chief Innovation Officer at Boston Children's Health, epidemiologist and ABC News medical contributor Dr. John Brownstein. So, John, the WHO reporting this virus spreading to dozens of countries, infecting tens of thousands of people in just a few weeks. So how concerned should we be here in the States about this outbreak?
Well, Kira, we're hearing about another public health emergency. I know we've spoken daily about COVID, and now we're talking about another virus. Clearly has a very different risk profile, and it's not that it's spreading to millions of people like we've seen with COVID, but it's still having really important public health impact. We are seeing 17,000 cases worldwide in just about 3 months, over 3,000 almost here in the US. And we've had the opportunity to contain this outbreak, and we just haven't done so. It's potentially another failure of our public health systems to contain a virus that really could be identified, treated, vaccinated. This is not something that new to us like it was for COVID. That's why the WHO has declared a state of emergency when it comes to its consideration of monkeypox. I likely think it will be the same here in the US, that we'll declare that same state of emergency to unlock funding around treatments, vaccines, testing. We need those resources now before this monkeypox becomes fully endemic in our country.
And as Eva mentioned, we know there are at least a couple of children with monkeypox in the U.S. Are symptoms different in children?
It's about the same. And thankfully, we've only seen 2 children with monkeypox in this country, over 70 actually globally. So it does tell us that risk isn't just among adults, it's primarily adults, but transmission is occurring among households that, where there's close contact, and that's why we have to be concerned. The symptoms, these monkeypox symptoms of temperature, headache, muscle ache, rash, blisters, those are what we're seeing, across the age spectrum. But we have to remember these kids are in good health. They're getting treatment from a smallpox related treatment. So they're in good health. They're dealing with the virus well, but it does tell us that this virus is spreading across many demographics in this country.
Well, health officials say that men who identify as gay or bisexual are most at risk here. So what kind of precautions can this community take, and how's the virus affecting other communities?
Right. So it spreads through close contacts, mostly skin-to-skin touching, but it can also be through clothing or respiratory droplets. Anyone is at risk, through that skin-to-skin contact or sharing of items like towels. But, sex does seem to be a primary driver. And so it's important to follow very basic steps that we all know with COVID: isolating if you have symptoms, avoiding skin-to-skin contact, washing your hands, cleaning households that get touched regularly, wear a mask if you're around someone that potentially is infected, and vaccination testing, still the cornerstones of a response. Just like it was for COVID, it's the cornerstone of a response here for monkeypox as well.
All right, Dr. John Brownstein, thanks so much. Good to see you this morning.
Thanks, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.